Estás viendo Canal América, televisión dominicana para el mundo.
A Time for Truth Show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard, you don't know where to go. Everything keeps falling apart, yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth Show. I'm your host, Dr. Bernard Fialkoff, and I hope you had a great holiday season with Passover, Easter, with families, rejoicing, celebrating spring. And today we have a very important show for very important people in our lives. Our mothers, our wives, our girlfriends, our grandmothers, our daughters, and our great-grandmothers. Those people who brought us into the world, who nurtured us, took care of us. And today we're going to go over something in terms of gum disease, women's gum disease. It's a very prevalent problem in the country. I'll show you very soon. And it's correlated with very important diseases that we need to control. One is cardiovascular, heart disease. So periodontal disease is correlated with heart disease, and periodontal gum disease is correlated with diabetes. And diabetes also, again, with heart disease and vice versa. So the three of them act in a triangle to affect each other. And it's going to be a very important talk we're going to give tonight, because we're going to see what is it and how do we control it. So let's start out with the first slide, engineer, and there we go. And very important to realize that about 47% of Americans suffer from gum disease, and this adds up to 64 million Americans 30 years and older. Now these are statistics from about 3 or 4 years ago, so these figures are probably higher nowadays. So what is gum disease? Gum disease, or periodontal disease, is an infection of the gums and bone caused by the germs that grow in the mouth, which in dentistry we call plaque. That plaque grows and it adheres to the teeth, and then it starts forming with the calcium in the saliva and some blood products into tartar, or what we call in dentistry calculus, little stones. These little stones are great places for the bacterial plaque to grow even further, and then the gums start to swell, turn red, they get sensitive on you, they bleed very easily. It's called gingivitis. Gingivitis is totally reversible, and eventually, if it continues beyond gingivitis, now it starts turning into the periodontal gum disease that we're talking about. It's irreversible. You start losing bone, you form spaces in the gum that accumulate food, bacteria, more tartar. These are called pockets. And if left untreated, it progresses. You get more and more bone loss. You get gum recession, sensitivity. You lose the teeth. You need implants. You need bridge work. You need other types of treatment. The teeth shift. You may need a little bit of orthodontics to realign the teeth. And this can occur really at any age. And it's not a constant line. Some people get it more than others. We'll go over that soon. And women are especially susceptible to periodontal disease at various stages of their lives. We're going to go over that because the hormonal changes that occur affect the blood supply to their gums. So let's put on the video that we have for you showing you the sequence of periodontal disease developing. And here you see at the beginning, totally healthy periodontal structure. The gum is healthy, the bone is healthy. We divide that, and now we're going to start forming periodontal disease on the right side of the screen. You see the bacteria, the little dots are forming. What happens, this person wasn't actually educated in the importance of flossing every night. It doesn't really matter what type of floss you use. You can use waxed, unwaxed, mint flavor. Any of these will work, but if it doesn't occur, you get more and more of this forming. You see the bone receding, you see the gum receding, you see the gum turning red. This is because the bacterial plaque are affecting the bone levels, destroying the bone. More of it forms. Now the tooth, you see, starts shifting, it's moving, it's getting mobile. It's getting mobile because the bone support is being dissipated. And so what happens is, at this point, the person notices it, but it's gotten way too advanced. We don't want to wait to this stage of the disease to have this occur to us. So now if we go to the next slide, and we're going to go over the factors that are associated with periodontal disease, and the engineer is going to be putting up the slide for you, and we're going to be covering the different factors that cause periodontal disease. One of them is, as I mentioned already, your hygiene habits. So by all means, you want to brush twice a day. You want to floss once a day, at nighttime preferably. And if we go back to that slide, it seems like the program went by itself, but I'll continue talking. And so what happened is that if we go back to the original slide that we had, there we go. You see that the second factor that I told you about, diabetes, which is correlated with periodontal disease, we can insert the cardiovascular disease in this area too. Something very important is that the same person who doesn't smoke versus smokes, that person smoking will have 2 to 3 times more periodontal disease than the person who does not smoke. The other thing very important to go over, especially nowadays, is vaping. Vaping is causing tremendous problems with gum recession, sensitivity, tooth decay, because it causes what's called in dentistry xerostomia, which is a dryness of the mouth, and that dryness of the mouth leads to more of the plaque adherence. It's great for them to grow. The saliva also has antibodies and different factors that would prevent the bacteria from growing. Unfortunately, when you have a dry mouth, the saliva is not there, so the immune system can't actually get at these, these enemies of the mouth. And so what happens is you develop recession and the bone loss. Now, what's important to realize is vaping, which was developed as a cure for the smoking, is equally, if not more so, destructive to periodontal structure, and it's highly addictive because the flavorings have nicotine in really almost all the flavorings, as shown by the CDC. Now, the other important factor is the genetic predisposition of the person. Not every person is going to react the same. Some people will have very little reaction. Other people will have exacerbated or more severe reaction because they're predisposed. So if you realize in your family history that your parents lost their teeth early in life, or they've undergone periodontal surgery because they had periodontal disease, or they had teeth extracted, had implants, had bridge work, it's very important for you to realize to control your periodontal disease by having frequent visits every 3 months to prevent the problem from occurring, because you have that predisposition. The systemic diseases we just mentioned. There are hormonal imbalances, which we're going to go over now when we start touching on women's periodontal disease. Stress, which is a very important factor amongst all of us. Stress is another one we're going to touch upon. And also the medications that are used to treat periodontal, not only periodontal disease, but other diseases, systemic diseases, hypertensive medications, epilepsy medications, and cardiovascular medications. These all have an effect on the gums, and also psychiatric medications, which cause a dryness of the mouth and causes a lot of excessive muscular movements in the mouth and leads to bruxing or clenching of the teeth, which again causes problems of tooth fracture, bone loss, gum recessions, a lot of problems. So there you have the factors. Now let's go on. And we'll go to the next slide. And then this next slide, we're going to show you what starts happening, and we're going to touch now on more the woman's side of this. And this is a woman. She may be experiencing her menstrual period. During the menstrual period, obviously the hormone levels increase, and you see her gums getting red, getting puffy in between the teeth. You see some darkness between the teeth, because as this inflammation occurs, and the gums swell, the bacteria have more crevices and crannies to get into, and they start staining the teeth, and they start forming mild tartar deposits that, if they're not taken care of, will progress. So it's important when you have your menstrual period as a woman to make sure that you're flossing every night, and that that you're really maintaining healthy hygiene. If you find at some specific period that it seems to be getting worse, you may be a very good idea, maybe a good thing, to visit your dentist and have a cleaning. Sometimes you need a cleaning more frequently. I wouldn't use just an arbitrary 3, 4, 6 months as just an arbitrary number. As you're learning now what can happen in your mouth, you can apply your instinct and go accordingly. Let's go to the next slide. And this was what we were talking about during the menstrual period that women can experience. It's called menstruation gingivitis. Why gingivitis and not periodontal disease? Because it's more of an inflammation. It's reversible. Normally, it's going to go away on its own when your period resolves. But during that time, your gums can become very red, swollen, sensitive, and you may not really be comfortable. So it's a period where it's really important to have a very high level of hygiene. Let's go on to the next factor that women are exposed to, and that's obviously pregnancy. Because with pregnancy, then you get more permanent and increasing hormone levels as that newborn starts developing in the womb, and the woman starts undergoing hormonal changes systemically overall, and the gums can swell. During this time, we definitely recommend that you have a 3-month interval, not 6 months, by no means a year. This is very important to control the pregnancy, what's called pregnancy gingivitis, because pregnancy gingivitis really can lead in many women into bone loss and having to need laser treatment or surgical treatment. In some who are more predisposed, they may actually develop such severe periodontal disease that the old adage of they give up their teeth for their children are true. Some women, unfortunately, are very susceptible and will lose 1 tooth, 2 teeth. Some, if they're very susceptible, can lose more. So it's very important as a woman watching this show that you visit your dentist frequently, that you brush twice a day, that you floss, avoid sugars, avoid sticky foods, and try to go more with a natural diet. It's good for the newborn child also. More fruits, vegetables, proteins, so that your newborn can develop really in a good condition, because you wouldn't want to develop a pregnancy diabetic condition also, which could affect your newborn child. Let's go to the next slide. So here you see the redness of the gums, and this is a pregnancy gingivitis. You see the teeth are very white. There's no tooth decay. She doesn't have any fillings, but there's a tremendous amount of inflammation occurring. And obviously with the inflammation, sensitivity, tenderness. So, they're going to have difficulty having comfort when they're brushing, when they're flossing. So it's an important thing to prevent. Once it goes to a point and it goes too far, then you need our help in the dental office. You can see your dentist. If you're seeing a periodontist because your dentist referred you for periodontal disease, come to see us more frequently, and we will keep you under control. Usually, we really monitor pregnant females much more closely. Let's go to the next slide. And on this one, Again, we'll show you a little bit more. Go back to the other one again, please. And again, this one is showing the pregnancy gingivitis, and you see the redness of the gums, the puffiness of the gums, and these are from the hormonal changes, the increasing in the progesterone, the estrogen, and the hormonal changes lead to more blood supply. It's for the newborn, but unfortunately has other effects in the mother, and these are one of the effects that we will encounter. Let's go to the next slide, because what happens in a certain percentage of women, this inflammation can really become more severe, more pronounced, and most of the times in a localized area like you see, we'll develop something called a pregnancy granuloma or a pregnancy tumor. It's not a cancer, it's nothing to be alarmed about, but obviously it's also very unsightly, very uncomfortable, it's going to bleed very easily, and if you're pregnant and you develop this is something we take care of very simply with a laser. We don't have to use a scalpel, that's antiquated. In my office, we do a tremendous amount of treatment with a laser, and the laser will remove this pregnancy granuloma, which basically occurred, again, for the same reasons, but there was a lot of irritation in the area, and because of the irritation, it exacerbated, it got bigger, and so you form this local growth of soft tissue. Let's go to the next slide. Now, at this point, after a woman has had their family, she's getting up into her 50s, and now she starts encountering hormonal changes again, this time as the hormones start dissipating, and she gets premenopausal or gets menopausal. And what starts occurring is with these changes, again, come changes in the oral cavity. As she develops this menopausal syndrome, she may experience what we call xerostomia, dry mouth. And the dry mouth can also be associated, and frequently is, with a burning sensation. You may wonder, why am I getting burning? Why are my gums so sensitive? Well, unfortunately, this is one of the other things that happens with the menopause. And, that also can be treated by the laser. We run a little laser light over the canker sores that occur, the different areas that ulcerate, and that gets to get the pain to be alleviated, to go away. When there's a lot of dryness, one of the things that I recommend is artificial saliva, because you want to keep the oral cavity moist to avoid developing tooth decay, because when you develop the dryness of menopause, you're very susceptible to having cavities. Now, you may have said, well, but I had my teeth capped, it's not a problem, or I had veneers placed. But no, you'll really be very susceptible, because the bacteria get in the margins, and the bacterial growth in these margins can lead to, again, plaque accumulation. The plaque with the sugar in the foods that you eat form acids, and they will cause decay below your crowns, around your veneers, or really on the biting surfaces of your teeth, maybe where you had fillings, or maybe where previously you didn't have any. But now you have a dry environment. In that dry environment, things have changed, because remember, the saliva helped you to not only calcify the teeth, antibodies to remove the bacteria and kill the bacteria, but also the salivary flow flushes a lot of debris out of the mouth, out of the crevices around the teeth, and you swallow them. So that's part of what's going on in the oral cavity, but unfortunately, with a dry mouth, that doesn't occur at this point. Something else that we recommend in the office is you can chew sugarless candies. And chewing sugarless candies also is a very good way of trying to keep your saliva at a high level, so that you can try to prevent these consequences of the menopausal changes in your mouth. Let's go on to the next slide. Now here you see, and if you wanted to do a self-examination, if you're in front of your mirror at nighttime, you could take a look, and if you're in menopausal and you start seeing darkness around your teeth, like you see here on this woman here, you see around the gum margins, she has darkness. That darkness sometimes can be lucky to be staining, but other times it's not just staining, and it is actual what's called root decay. The enamel is what you normally see in the mouth, but with recession, you get root exposure. Now the root of the tooth is much softer, so that softer tooth structure is more susceptible to the dry mouth and the bacteria which are going to grow, and so the acid that's going to be produced by those plaque will actually cause decay on the root surfaces. The root decay goes much more rapidly, so if you see something like this in your mouth and you haven't been seeing your dentist, then I would urge you, go to your dentist, have them examine your mouth, and catch the root decay before it gets too far. Sometimes that root decay will actually cause abrasions, and you'll see these big hollows that occur around the teeth. It's important you get your general dentist to restore those areas, fill them up, so you don't end up having so much either decay or abrasion that you develop a root canal, a need for a root canal, because when it goes too deep into the tooth, you get near the nerve tooth structure around the nerve, you get to the nerve itself, and then you end up needing root canal and having pain. These are all things that you can avoid. Here you see that this woman also has a lot of abrasion of the biting surfaces, and it's something we're going to talk about soon, which are stress levels. Let's go to the next slide. And here again, this is the menopausal dry mouth we were talking about. We're talking about the artificial saliva, the sugarless candies to stimulate the salivary flow. Next slide. And now we want to get to something, because obviously when women are undergoing these hormonal changes, there's a lot of stress. So if we go to the next slide, and we're going to talk about these hormonal changes and the stress associated with them, which are the cortisol levels. An engineer, if you put on the next slide, and with it, there we go. And here we go with the cortisol levels. Now, what does stress do? So the stress, you're not sleeping properly, or you're going to sleep later, because a lot on your mind. And what happens is you get an increase in cortisol. Cortisol is a hormone. But the problem is now with the stress and the cortisol level increasing, and you're a woman, maybe it's getting close to warm weather, you want to put on different types of clothing, you wear less clothing, and you feel uncomfortable with your clothing, and you've gained a little bit of weight. Well, probably it's occurred because cortisol levels, besides with stress, also go up with an activity. In the wintertime, we're cold, there's ice, there's snow, we don't have as much activity. So if you've been prone to not having activity, that also increases your cortisol levels. And these cortisol levels get you more hungry. So now you eat more. And you're trying to diet, but you're stressed, and you're fighting with yourself. And so now that has more stress, and you grind your teeth. And so now you develop what you saw with the other woman, where you have the wear on your teeth, and you don't like the way it looks, and you want to go get that fixed. But you're also upset that you have it, and maybe it's very costly and you can't afford it. So now you have this vicious cycle of the stress, of the grinding, of the cortisol level going up, of the weight gain. And with the weight gain, unfortunately, you could be predisposed to a pre-diabetes, or if it's in your family history, you develop now diabetes. And let's say that you're still young and you want to have kids. Well, obviously, you don't want to be diabetic, because diabetes would be an adverse cofactor to have, along with high blood pressure during your pregnancy. One of the things I wanted to mention to you with pregnancy gingivitis is very important to control it, because women who do have pregnancy periodontal problems have a tendency to have their babies too soon, called preterm, and also low birth weight. So their babies have a low weight when they're born. This associated with the periodontal disease. So again, you can see the importance of controlling that. Let's go on to the next slide. And let's get away from the stress. And let's now go to something positive. We mentioned the things that we have to look at. So we know we have to control our stress. We have to get a good night's sleep. We have to eat a diet that's healthy without too much sugar. We have to brush twice a day. Any toothpaste is fine. We have to floss at nighttime. Waxed or unwaxed, mint flavored or not flavored is fine. You want to visit your dentist or periodontist at 3-month intervals. Normally, the periodontist will alternate with your general dentist if you have a periodontal problem, and we alternate the visits. But now, let's say, unfortunately, you develop recession, like you see in this woman on the top slide, and you see her incisors have receded. She's got this ugly muscle pull. She's unhappy. And so, what can we do? Well, we have something called soft tissue grafting or gum grafting. And there you see the result of the gum grafting. You see the tremendous change in her cosmetic appearance. You also see functionally that this is going to be a barrier to more recession. So she's going to have healthier gums, nicer looking teeth. If she needs to do veneers or anything else, it's going to be against a backdrop of healthy gums. And she's going to be very happy because she's going to be very comfortable eating. Her teeth won't be sensitive. Her teeth won't bleed. Her gums won't bleed. And she'll be comfortable. And she'll be comfortable and also confident when she's with her friends out at night. Let's go to the next slide. Again, something positive. Sometimes, you get severe recession, like you see on the upper slide. This is a young woman. She was approximately 33 years old. She came to me on the upper slide, and she really wanted to get it fixed. She didn't want to lose a tooth. She didn't want to go through a dental implant. And so we did a gum graft procedure. And there you see the result. 2 months later, she was ecstatic. Obviously, you realize the stress decreased. And, I can't say to you it's going to happen, but obviously, if you feel comfortable, if you're happier, the stress levels go down, you're going to sleep better, you'll be more comfortable with your friends. And this is, again, it's called soft tissue grafting. We do this all day long in the office. It's something that's available to you. So don't get distraught. Don't stress out. If you come, you can be examined. Many of these things can be repaired, and I work with your general dentist to actually fix things. I'll show you now the next slide how we work with a general dentist. Go ahead, and here you go. Here you see her initially, recessions, cavities, the gum's a little bit inflamed. Go to the next slide. And with her general dentist, this happened to be Dr. Volker, and here you see how she looks after we treated her gum problem, after we treated her decay. We gave her these nice bonded restorations, and you can see how beautiful her smile is now. And no comparison to what she had before. She's ecstatic, she was happy, and it's a pleasure to do this. So for the women out there in our lives, and for the women who are watching, if you're the husband, now you know what you can give her for a present so that she can have the smile she's always wanted. And for those women who are out there, now you know what to do to have healthy babies, have healthy children, have your healthy gums, and not to give up your teeth for your children, but to have your children, have a beautiful family, and to preserve your smile, to have your confidence, and so that this way we can repay all you've done for us. And this show is for all our mothers, our wives, our daughters, our grandchildren, our grandmothers, and our great-grandmothers, for the women of our lives. Thank you so much for what you've done, and may you smile and be happy lifelong.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. at your feet.